Well, over the weekend, the Lagos State Governor Babajide Sanwo-Olu launched a free care pack for COVID-19 positive patients who prefer home-based care. We have a public health physician who joins us here in the studio, Dr. Adewale Adebanjo. Thank you for joining us on the program.
Thank you very much. Thank you for having me.
So this is a sort of telemed, isn't it?
Yeah. Well, basically what the governor is just trying to do is that to really make sure that a lot of people do what we call self-isolation at home, because we're so lucky in this part of the world that most of our cases are more of mild to moderate cases. And we realize that most of the isolation centers are actually underutilized, because basically that should even be meant for people with severe cases. So those who have mild to moderate symptoms can actually self-isolate by their home. They can really get well if they observe certain precautions. Of course, before this whole management could actually work very well, there are certain things that has to be put in place. Number one, there should be a clinical assessment of the patient, and which should be on each patient basis. We have to consider certain things like patients who are vulnerable might not be able to do what we call home management, like people above 60, people who have other comorbidities like people who are hypertensive or diabetic, people who are asthmatic, and also depending on the kind of the presentation, people who actually present with a very high fever of over 30 degrees centigrade, people who are dyspneic, having some difficulty in breathing, those kind of patients might not be able to self-isolate. But majority of the cases, about 80% of the cases are just mild to moderate cases, and they can actually self-isolate. So management can actually work for people like that.
But what about the residential setting?
Now, in residential setting, that's where the issue has been, because we will realize that most households, it's going to be difficult to see where you just have just one person occupying a room, especially when you consider some parts of some areas in Lagos. I'm not going to mention some areas like that. But of course, what we actually need to do after accessing those patients based on their symptoms, and you now discover that such a patient can self-isolate, you go do the second stage, which is trying to assess the home setting. You can't just tell someone go and self-isolate and they're 10 in that room. How would the person self-isolate? So in most cases, the government might need to look at the area. If the home setting is not so conducive for self-isolation, we can still look for a place in that same community where people can self-isolate, provided their cases are just mild to moderate. And of course, there should be people who they can talk to, like if the case is actually getting out of hand. Because by the time you start noticing that the patient who comes with just asymptomatic suddenly can become symptomatic. Fine, that might not be very common. But we have to tell the patient, educate them on what signs, when they see certain signs, and who to call so that they can get attended to.
All right, we appreciate your time. Thank you so much, Dr. Adewale Adebanjo, public health physician. Thank you for joining us on the program.
Thank you very much.